Hello, my name is Dr. Rajiv. Welcome to my education channel, Surgery and Orthopedic Education. Today I have a general surgery lesson for you, that is graded nature of the injury response. Please subscribe to our channel if you have not subscribed yet, and don't forget to give us a like at the end if you find the video useful. So let us not waste time anymore and start right now. Every injury, small or big, produces a local and systemic body response known as metabolic response. The response is in the form of a physiological, metabolic, and immunological change or sequelae in varying amounts and combinations. It is important to note that the response to injury is graded, which means the more severe the injury, the greater the response, and it evolves with time. Response after mild and moderate injury. Following an elective surgery of intermediate severity, there may be a transient and modest rise in temperature, heart rate, respiratory rate, energy expenditure, and peripheral white cell count. In certain circumstances, the severity of the injury results in quantitatively different responses instead of being a simple dose-dependent metabolic response. Genetic variability plays a crucial role in determining the severity of the post-traumatic inflammatory response. Response after severe injury. Following major trauma or critical sepsis, the above changes are accentuated, resulting in systemic inflammatory response syndrome or SIRS, hypermetabolism, marked catabolism, shock, insulin resistance, and a terminal and often fatal multiple organ dysfunction syndrome or MODS. MODS. In more technical terms, immunological sequelae of major injury evolve from a pro-inflammatory state driven primarily by the innate immune system through macrophages, neutrophils, and dendritic cells into a compensatory anti-inflammatory response syndrome or CARS, CARS, characterized by depressed immunity and diminished resistance to infection. In the presence of septic complications, the CARS results in ongoing systemic inflammation, acute phase response, and continued catabolism, and finally may change to an adaptive immune response aimed at restoring the classical homeostasis back towards recovery from a severe inflammatory state. Counter-inflammatory or adaptive immune response to injury. Counter-inflammatory responses are a natural and protective compensatory host response to trauma-induced inflammation. Major injury leads to diminished resistance to infection due to a physiological response to trauma known as compensatory anti-inflammatory response syndrome CARS. CARS. CARS is mediated primarily by the adaptive immune system through T and B cells. CARS counters the inflammatory SIRS response in order to avoid continuous injury to the host. CD4 cells, also called regulatory T cells or TREGs, control inflammation in autoimmune and inflammatory diseases.